Everyone, a big welcome to everyone. I think we should see if people can be let in with the door open. Hello and welcome back. We're here now for another interview, this time with the Regional Director of Europe from the WHO, and I'd like to welcome Hans Kluge. He's joining us remotely, but he'll be on this big screen. Let's see if we can bring him up if he's here already. Specifically, we're going to be talking about a deeper dive into how Europe has been faring. He'll give us all the insights on that, but also, more importantly, the exit strategy that we should be looking in terms of the pandemic. Mr. Kluge, can you hear me? Can you hear me?
Yes, very well. Thank you so much. Do you hear me?
Thank you, and we hear you perfectly as well. I just want to mention to the audience, you began your term at the WHO for Europe on the 1st of February 2020. Is it safe to say that it has been the busiest 2 years of your life?
It has definitely been very, very busy. Absolutely. Absolutely.
Tell us more about what that has been like. You're sitting in a very special position as Regional Director for Europe. You have a behind-the-scenes look at everything that is going on. So give us more of an insight into your day-to-day work.
So in my position, which is a politically elected position, leading the coordination of international health for the region. So maybe first to specify that the region encompasses 53 member states. So it goes from UK, Portugal, to Central Asia, Caucasus, Turkey, Israel, to Vladivostok in the Russian Federation. And indeed, some people call me the COVID region director because I started almost, as you rightly say, at the same moment as the COVID-19. The big challenge, of course, is really to deal now with the backlog of patients who have been suffering due to postponement of, be it elective surgery, cancer screening, other health checks, and that's a big concern on top of the mental health. And of course, the COVID-19 was a big surprise to, not only for me, I think to all of us, but now unfortunately after 2 terrible pandemic years, we have the war in Ukraine, which is another very, very tragic catastrophe.
So for now, let's keep things in terms of the pandemic, because that's what I want to discuss with you on. You've mentioned before, even in the 3rd year of the crisis, there's, quote, no room for complacency. Tell me what you mean by this. Do you think we are still too complacent?
What I mean is that this virus has surprised us many times, more than once. So, to describe the situation we're in today, I use 3 keywords. The first one is hope. I think it's very important because the people are so tired of the pandemic, their mental health issues, and there are reasons to be hopeful because there is a global, tremendous capital of immunity, either thanks to the vaccination or due to natural infection, due to the fact that the Omicron was spreading so fast. So we're hopeful, same time we're vigilant, because we're not there yet, and there are pockets of populations who are not vaccinated, who are not boosted. It's always possible that there will be a new variant of concern. And then the third word I'm using is solidarity. No one is safe until everyone is safe. So the international solidarity shouldn't be a buzzword, but something very concrete.
And I think those words we've been hearing a lot over the past 2 years, they're certainly not foreign to us. We see that all the time now in terms of coverage of the pandemic. You speak of hope. One thing that we can discuss is this look at exiting the public health emergency. You're trying to devise a plan for Europe. What does that plan look like?
Yes, here first and foremost, I would like to give credit to Professor Antoine Flahaut from the University of Geneva, because I established about a year ago a high-level technical expert group to look monthly at the evidence and update a roadmap, because they're the big strategic directions, but what ministers of health, chief medical officers are asking me is something more concrete, a roadmap how to get out of the acute phase. So the first point I would say is to protect the vulnerable. So we may at some point have to shift from mass vaccination to more routine vaccination of the vulnerable people, particularly if we look to the fall. We will need a fall strategy. So this is number one. Number two is still to do whatever it takes to vaccinate the unvaccinated and to boost the vaccinated. Number three is to beef up the surveillance capacity and capacity for genomic sequencing, like for example the country I'm currently sitting in, our host country of the WHO regional office, which is Denmark, which has tremendous surveillance and genomic sequencing capacity. So if there is somewhere a problem, the system is able to pick it up very quickly so that any national lockdown can be avoided. And then the fourth point is to deal with the backlog of patients with other diseases or events than the COVID-19, including what we call the long COVID. And that was a recommendation of the Flahaut group very clearly. We need more research into the long COVID. I think every one of us know people, sometimes young people also. We know about 20% of the infected patients with COVID-19 still has signs and symptoms 12 weeks and later and can be very invalidating. So we need more knowledge on the long COVID.
Okay, to summarize for our audience, for you, the key steps in exiting a public health emergency would look like protecting the vulnerable, making sure that the unvaccinated also get vaccinated, beefing up surveillance capacities, as well as treating this backlog of other diseases. You've outlined that very clearly, but in reality, how easy or how tricky is it going to be to roll this out and enforce this?
Yes, it's tricky. Why? Because we know that with each pandemic, there is a cycle of panic and very quickly followed by a cycle of neglect. Human memory is very short, which frankly speaking also has its advantages, because there is so much misery and so much suffering that it's maybe also a defense mechanism. But our memory shouldn't be short of our heads of state and government to forget that investment in health and health systems is key for a resilient society and pandemic preparedness. That's why I established a year ago the Monti Commission, a pan-European commission to rethink policy priorities in the light of pandemic, chaired by Professor Mario Monti, previous Minister of Finance and Prime Minister of Italy. And this is a key condition for better pandemic preparedness: investment in health system, particularly primary health care, the workforce, because our workforce is very fatigued. I always say, when I meet a president or a prime minister, health is not everything, but without health, there is nothing.
You have a clear roadmap for making sure that we come out of this pandemic. Can you tell us the timeline that you actually foresee for this? Because for our audience, should we expect, by the end of the year, we should have reached a certain stage by the end of next year? What would be a hopeful outlook for you?
This is also a very tricky question, because there has been many predictions and this virus surprised us many times. What is the good news? The good news, the hope is, it depends on us. There are no big surprises here. For example, if a country releases too brutal the restrictions from very strict to lifting all measures, we can expect a huge increase and another wave. But then again, the hopeful news is that in countries with a high vaccination rate, a high booster rate, even if the number of cases increase sharply, we should look a little bit less at the number of cases, but more at the deaths and the admissions to the intensive care unit. And in several countries, countries are holding the flags. Again, to use the example of the host country, Denmark here, I mean, for a long time, and there was then Omicron 1, Omicron 2, lot of cases, but the hospital admissions decreased, the deaths decreased. So it really depends on us. And coming back to one of your previous questions on what could be an obstacle, it's human behavior. That what we would hope for is that the masking, public health measures are becoming part of healthy seeking behaviors. The people in China were much more faster because they had much more experience with pandemics. Here we had to do a lot of convincing, for example, on the masking, the physical distancing. So hopefully this is a big lesson learned, that if there is another worrying wave, that people will be much more fast in their behavior.
We've been through lockdowns, we've done vaccinations and still going through that, widespread public health campaigns, social distancing, even to the most basic hand sanitizing. What is left in the toolkit?
I think the toolkit remains more or less the same. Maybe if I have to pick out one, and again this comes out of the Professor Antoine Flahaut group, is a bit more focus on the antivirals to ensure affordable, equal access to antivirals. We know that the best way to combat an infectious disease is a combination of prevention, a vaccine, and treatment, medicines. So that's definitely a promising tool in our kit.
Can I get your take on just another potential tool we might have? What about the stress testing of national healthcare systems? How could we go about doing that? Because we've heard from a lot of panels and talks before that going forward, that's going to be a big priority, and we really don't want to leave that behind and forget, as you said, with our attention span, move on to the next thing without making sure that these health systems are robust. How can we stress test these national health systems?
Right, a couple of points here. The first one is that the best defense against stress for a health system is the primary health care. We go back to the basics, whether it is to improve health and well-being, integrate measures to deal with mental health stress or pandemic preparedness. We have to bring care closer to the homes and the communities of the people, with a larger role for the nurses and the social workers who have a close contact and not so much barriers with the people, and a lot of attention to the health workforce. There is no health without health workforce, and of course with a strong digital component, because thanks God that the digital was there, or we would have been completely isolated from each other. So before the pandemic, digital was optional. Now it is obligatory, but it is not a panacea, and it's not just a gadget. It has to serve the goal, meaning providing equal access to quality care. Number two, in the WHO Regional Office for Europe, we are starting with simulation exercises on stress tests, including, and that's a novelty for our European region globally, including politicians, because WHO used to have benchmarks on which health systems are best prepared. And surprise, some of those countries which were ranking very high, their health system collapsed because it did not take into account the governance. To put it bluntly, if you have a group of top public health physicians advising the government, but the politicians do not listen and they take decisions irrationally, then you can have a very strong health system of public health, but it's not going to work. And we saw this in some countries in the world, be it on masks, on other issues. So we need a revised system of indicators to tell us how prepared the health systems are. And for this, I was going to the United States, talked to Dr. Anthony Fauci and the people of the HHS over there, and developing a tripartite memorandum of understanding between WHO, Pan-American Health Organization, WHO Europe and Central Asia, and HHS in the United States, because we were the two epicenters of the pandemic, and we have so much to share and to learn from each other.
This brings it nicely. For some of you, the audience who were here this morning, we did have one guest who was saying that the US and the UK were ranked by the indicators as being extremely prepared, but it turns out that there were also other faults at play, other factors that impacted their strategy. So maybe to your point, there might need to be a new kind of index or indicator for that. Now, your specific focus is Europe, and since you're here, I would love to get your take on that. In Europe, you've mentioned that countries are at different points of the trajectory of the pandemic. Can you give, just in a nutshell, an assessment of what you're seeing? How wide is this trajectory from, from one end to the other?
What we have seen through the trajectory of the pandemic is that what's happening in the West usually transcends 3 to 4 weeks later towards the East. And this has been quite consistent, with of course some exceptions depending on which measures the governments were implementing. But also now in the East, you see that the cases are going down, mortality is going down. So we are in, I called it, a kind of a ceasefire, at least from the pandemic point of view, that it's quiet and we have to take advantage. Because obviously, due to the fact that the Omicron was spreading so fast, so many people were infected, which means the new mutant is already out there somewhere, but it doesn't have to be a mortal one. I always say that it could have been much worse. Imagine that the SARS-CoV-2 was as infectious as measles and as little as Ebola. I mean, then this would have been a much more bigger one. So I think we're hopeful, but what we need now in the region is literally a ceasefire, because in Ukraine we don't have an idea anymore about the number of cases due to the fact that the system suffers so much now, and then of course it's an infectious disease. So it comes back to what we need is international solidarity, and health is the way towards peace.
And Europe is so vast, we cannot talk about it just as one category or put everything into one bucket. If you could single out one state, one nation that you think has come out on top or is more closer to this exit strategy, what would it be? You talked about Denmark a lot. Is there another country that you can give as an example? Or you can still continue talking about Denmark?
Yes, but this is a very tricky question, and we in WHO, we are there to assist countries, so we don't point out countries, but even Denmark, when the Minister of Health, Magnus Heunicke, was telling to the people of the country that they were lifting the first one, all the restrictions, he was very smart. I mean, they have been very good in risk communication all along. He was telling it does not mean that at certain point we will not have to reintroduce the measures. And I think it comes back to one of the points, what needs to be done. Our health systems have to become agile. Our health systems are like huge tankers, which are very difficult to move. They have to become more agile, like smaller ships that they can be a little bit more restricted, they can open up, they can re-profile hospitals, they have some reserve cadre of the workforce. So this has to happen. I think in general, I would like to look from a pan-European perspective that as a European region, we're quite well set. We're not there yet. The key issue is if there's another pandemic tomorrow, everyone has to ask the question in the audience, are we better prepared today than yesterday or not?
Mr. Kluge, maybe just to wrap up, and I'll continue the discussion a little bit later. What would you like to see if we have the chance to speak again the same time in a year's time?
What I would like to see, and we're working on that one,
if we get to meet again at this same time in a year's time, what would you have liked to see?
a pan-European system which can pick up any threat very quickly, be it on antimicrobial resistance, on a dangerous virus, or climate change. We need a alert. There were two problems on the pandemic. One is the alert system. We need an alert system to pick up the threat, number one. Number two, if the alert is there, we need the political trigger to be faster. So the alert system and a political system to trigger action much faster.
Mr. Kluge, thank you so much for your time, and hopefully by then the exit strategy will be at a different stage, correct?
Yes, absolutely. Thank you so much for this opportunity.
Thank you so much for coming to us from Denmark.